Okay, so hello everybody. Today I want to talk about nursing school online clinicals. So, as I'm sure everybody knows, the COVID-19 pandemic has kind of put a wrench in like everybody's plans and pretty much everyone's life right now. So, I just wanted to show you guys a little bit more in depth of what it's like being a nursing student because like half of our program is based in the hospital and learning from nurses actually working in the hospital. And as of I don't know the exact date, but probably about 3 or 4 weeks ago, we were told we are not allowed in the hospital anymore until the situation gets better. I believe that was mainly because of the PPE shortage. I think that was a big factor, at least for my school, in deciding that they didn't want to have us go. But also just the safety aspect of it. I mean, this was a new disease that showed up and nobody really knew too much about it. So I think the least amount of people that really truly needed to be exposed to it as possible was kind of where their head was. But anyway, regardless, here we are and we're trying to learn how to be nurses online. So let me just jump right in and show y'all exactly what I've been doing. Okay, so first off, we're gonna be in my bed because that's where I've been spending most of my time. I want this to be as realistic as possible. Yes, I'm doing clinical from my bed. So this is Elsevier, I don't know how you say it, Evolve, basically. So my school has implemented Evolve simulations as our replacement for clinical. I don't know if that's what every school has done or if it's just like my school. Like, I don't really know, but I'll show you what I'm doing. So I'm in my medical surgical class, so that's the clinicals they've been having us do. So this is pretty much all of the different scenarios to choose from. There are 45, and every week my school will assign us two because we have 2 clinical days per week. So like scenario 1, for instance, I believe this is the one we did last week with Wallace P. Yeah, so scenario 1 and then scenario 2. So these are basically what we went through. So you would do a reading assignment, which was like abnormally long. I would kind of skim through like things that I didn't know already. So this was a respiratory simulation. So this guy he came in with pneumonia, and then I believe on scenario 2, which is the scenario I'm inside right now, he progresses to have acute respiratory distress syndrome and he needs to be transferred to the ICU. So basically you do the reading assignment, you do a pre-quiz, which kind of just asks you different things about, like, I don't know, things pertaining to the simulation. So you do a patient report, which I believe, let me open this up. Okay, so that is, patient report is kind of like your little like data sheet that tells you like their age, their sex, their medical diagnosis, if they have any allergies. It'll give you their most recent vital signs, just like kind of like a summary of the patient. And then the EHR is where you actually go in and you do the simulation. So I don't know if it'll let me open it up because I've already done this simulation, but basically you go in. I'll show y'all like my work of what I've done, but so you go and you actually do the simulation, and basically it's like a electronic health record, and all I really do is you go in and you document like everything you've done. You don't actually do anything. Like, I expected an online simulation to be like there was like a patient and you would like walk up to them like in a video game like way and just like I don't know, click buttons to do certain things. I don't know, that's what I had kind of imagined, but no, you're basically just like documenting everything you would do with this patient, and like you don't even see a patient. It's literally just like you're on the computer at the hospital. Like if you guys have ever been to your clinical yet where they let you document things or just get on the computer, that's literally like what we do. We just go through the electronic health record and we document like basically all the information we were given, like vital signs, assessment, and then you can document like nursing interventions. So for this patient, he was declining like super rapidly, and basically you end up needing to put a 100% non-rebreather mask on. So like you just go into wherever in the simulation, you click nursing interventions, and then you click like apply oxygen or something like that. Or you can give meds too. Like you can go to the MAR and say the patient has a fever, and you can give them Tylenol. But that's basically it. Like it's not actually, okay, I think it's better if you can see me. It's not actually like you're walking into like a virtual simulation. Like that's what I thought. That's kind of what they made it sound like. And no, like, no. And it doesn't even like, I thought the system was gonna like respond to what you do. Like if your patient has a fever of like 101 and you give them some Tylenol, like it doesn't pop up a little notification, oh, your patient's temperature has gone down to, I don't know, 99. No, that doesn't happen. Like literally nothing responds to you. You just document everything you would do in the situation that like they give you, if that makes sense. So like you document all of that, and then you go and you do an SBAR report, which is situation, background, assessment, and recommendation. So basically you just say, this is the patient, he's such and such years old, he came in with pneumonia, he's COPD, I don't know, you just basically tell, like it's a handoff report, that's what you give them, which I suck at. I really suck at handoff reports, like I don't know why, but I just do. So yeah, that's basically everything. Let me show y'all what I actually did. Okay, so yeah, so this is the simulation, and then I would open it up, but if I open it up, it like notifies my teacher and like they can grade what I've done. So like I don't want to do it. I don't want to open it up right now, but I can show y'all what I did last week. I think it's on these. Yes. Okay. So this is like the pre-sim. So like I was saying, the patient comes in with pneumonia, you kind of describe the patho, and then the secondary diagnosis, oh, you can go back, was COPD. So then you talk about that, and this is what's called the pre-sim. So basically you're talking about his disease state and just let you know about it, and then you go in and you look at all the meds that are in the MAR listed, and then you just do a whole write-up on every med. So like what's this one, like levofloxacin, that's an antibiotic, and you just kind of like the nursing interventions. Basically, you can go into your drug guide and find all of these. I use Davis, but there's tons of other ones. So yeah, that's basically all. Oh, and then the labs. So the simulation will give you labs, and you have to like know how to interpret them, and just like most of these were all like within normal limits, but like his white blood cells are high, so basically there's some infection somewhere in the body. Like that's basically all you do. And then he had a diagnostic test. He had a pulmonary function test, so you just kind of describe. You're basically just like taking everything and giving them all the information you know about it, so that your clinical instructor can like assess like if you know what you're doing or not. Like I guess that's the best way I can describe it. So like here's the simulation on day 2. So there was already a simulation on day 1, but I just have day 2 pulled up. So like my assessment, he had labored breathing, he was tachypneic, I don't know, some people say that different. Shortness of breath, retractions, oxygen use. The other thing is like, so they give you a scenario, and I don't know if let me pull it up really quick. Okay, so like this was basically these are the directions of like what we're supposed to do. So the pre-sim, read, assignment, um, all the meds, all the stuff I just showed you. And then when you get into the sim, like you have to go off this. Like this is what I was talking about. You don't actually see a patient. Like this is what you see when you walk in the room. Like these are the vitals, blah, blah, blah. He says it's hard to catch his breath. Where am I? I feel hot. And so it tells you he just came from the lab, or the pulmonary function lab, and he settled back in bed with his head at 15 degrees. So immediately when I read that, I was like, okay, he's having trouble breathing. 15 degrees isn't high enough. Like I immediately I sat him up. Like in the simulation, I documented that patient returned from blah, blah, blah. Noticed he was having like problems breathing. I elevated him to high Fowler's, and I reconnected the nasal cannula tubing, because here it says that it wasn't connected after he came back. But like even though I connected it and everything, when you go to physiological state 2, which is like the second part of the simulation, I know it's hard to understand. Like I don't know how to explain it. It took me forever to understand this too, but like it's just like I don't know, like it's hard to explain, but you do like, so like there's a time in the simulation. So like this, let me go back. Okay, so state 1 is like from this time to this time, and there's a little timer in the simulation. So like this is what happens between this time period and then in this time period. Like you have to look at this document and just like think that, okay, now this is what my patient looks like. Like the simulation doesn't tell you, okay, now it's physiologic state 2 and your patient still can't breathe. But look, it says until O2 is connected, his status worsens. But like I technically would have connected it as soon as I saw it when I walked in the room. So like that's kind of a little, I don't know, it's weird. But there's that. That's physiologic state 3. Apparently you connect the oxygen. He says thank you. And then that was all of day 1, I believe. So like the setting up for simulation takes way longer. Like the pre-sim, like doing the reading assignment and researching all the meds and the disease, like when you're actually inside of the simulation, it does not take long at all, for me at least. But you're supposed to look at like, there's like ER reports and all kinds of stuff you're supposed to look at. So there's that. So that's pretty much like how it runs. Like that's it. There's not anything else that we have to do for clinical, really. We do a nursing care plan, but it's like a really basic, just like 3 nursing diagnoses. But yeah, so that's pretty much like all we're doing for our clinical, which, okay, put it this way. You could either be postponed from graduating, which would like, I think would suck even more, because luckily where I am in my program, like my first half of the semester I was in like what's called Adult 1. So it's kind of like the way my school likes to describe it is like the chronic diseases like diabetes, technically COPD, even though this patient had COPD, and just those type of diseases. And then Adult 2 is like the acute patients, like the patients that go to the ER, the patients that are not, that come through the ER, the patients that go to the ICU, like the more critical, like acute patients. But I had finished my clinical through Adult 1, which is like managing like chronic diseases and stuff. So from that, I'm able to take my experience and kind of like tie it together with this. Like, I think it's a lot different than if you're actually in the hospital having to make these decisions for the patient. But, I mean, we have to understand that it's, like, the best that they can do for us. Like that's literally, like, we could either be doing this and, like, trying to learn as much as we can from it, or we can postpone graduation until this is all over with. And I just don't want to be in school any longer than I have to. It's been a struggle, honestly, but, and also for some people, like financially, being in school any longer than they have to is like really, really difficult. But yeah, so I think it like helps me with my clinical judgment, but as far as like is it making me feel more ready to be an RN, like on my own? I don't know. Like I can't tell because I feel like confident almost. Like I don't know, this sounds weird, but like I feel like if I had to graduate, like if I don't get the like obviously these clinicals, like I'm not going to go back and go to adult 2 clinical, like it's done, it's over with. Like I'm not going to get that experience. I think I have enough knowledge that I know like what's expected of the nurse, like what you need to be looking for, the common like interventions that you would do, like elevating the head of bed when the patient's out of breath, or like looking for confusion and like thinking, okay, are they declining, like are they having like respiratory issues? I don't know, just like little things like that. And no, I don't know how to put it, but like I'm not ready, but like I feel like it helps, this simulation helps at least a little bit, because you're presented a patient and like you have to think about what you would be doing. Like I guess what I'm trying to say is like it gives you time to think, because like when you're in the hospital, a lot of times like you're with an RN already who's like already knows what to do, and like so they'll go do it, and like you don't have time to think like, oh, I would have done that, or oh, I didn't think about that. I don't know, you know what I'm trying to say? Maybe, I don't know. But it gives me time to like sit down and think about like what's really happening with the patient and like what I would actually do. Because for me, like I get flustered really easily, like especially when I have people like asking me questions and I'm not 100% sure, like I get really nervous and like I don't know. So it's, for me it's nice, but I know for a lot of other people it's just not working for them. So yeah, so that's basically all I had to say about that. Thanks for watching and stay safe, everyone.